Let's talk about program modifications and supports for school personnel. So, what are program modifications? Program modifications include the use of school time and the use of school staff. It may also talk about modifications to the physical environment of the school. It could address individual health needs or actions taken by personnel to minimize distraction, adult support needed for activities like toileting, feeding, dressing, or transition. An example or two of program modifications could include assigning preferential seating. The teacher will place a student with a cochlear implant in their right ear so that their desk is situated so that they can best hear the teacher. Or a student with visual impairments may need to sit closer to the front to see what's on the board. You may also have to alter the physical room environment. The teacher will arrange the classroom furniture, temperature, and lighting to enhance the student's ability to concentrate and learn. You may also need private supervised environment for addressing individual health needs like catheterization. School staff will minimize distractions, for example, covering distractible items within sight during whole group instruction. Adult support across settings, so toileting, feeding, dressing, transitions. If the school requires the service of a school nurse, it must be documented here in order for the school to receive Medicaid reimbursement. This is the most logical place for it to be noted on the IEP. The other side of this section is support for school personnel, and that may involve specialized training for any staff who come in contact with a student, including bus drivers, paraprofessionals, general and special ed teachers, related service providers, and cafeteria workers. Teacher consultation is a support for school personnel. Consultation occurs when a special education teacher or related service provider meet on a regularly scheduled basis with a general education teacher regarding the instructional needs, either academic or behavior, of a student with an IEP. Consultation is provided to coordinate and plan supports to extend SDI into the general education setting. So some examples of supports for school personnel include teachers and assistants will be trained on the use of a communication system. School personnel will be oriented to a highly structured behavior support program. Physical therapists will train classroom staff for lifting, transitioning, and equipment use. Consultation between the special education teacher and an employment specialist regarding supports needed for work-based learning. School personnel, like classroom teachers, instructional assistants, will take health service training or safe crisis management training. And staff training including the bus staff on seizures protocol and emergency evacuation. So these are just the things that the teacher needs in order to be able to carry out the IEP.